Ever had to face your loved ones, your relative, or your friend being in an accident and everyone is worried what's going to happen to them? And after lots of treatment and medical care, they make a speedy recovery and everyone is happy about it. But when you try to communicate with them, they are unable to respond or understand what you are trying to say. This condition of having lost the language abilities following a stroke or a traumatic brain injury is termed as aphasia. Aphasia is an impairment of language affecting the production or comprehension of speech and the ability to read or write. Aphasia is always due to injury to the brain, most commonly due to a stroke, and most particularly in older individuals. The symptoms of aphasia are trouble speaking clearly, trouble understanding speech, trouble writing clearly, trouble understanding written words, trouble remembering words, trouble remembering object names, etc. I'm Piyush Semwal and I am an audiologist and speech language pathologist, currently pursuing MSLP from AYJNISHD National Institute of Speech and Hearing Disabilities Regional Center, Kolkata. As the world is currently dealing with an ongoing pandemic, COVID-19, or commonly known as the coronavirus, the speech therapy services have come to a temporary halt. As countermeasures to control the spread of the coronavirus, like social distancing, are taking place, today we are going to talk about telepractice for the language disorder of aphasia. As of we speak, there have been almost more than 9.1 million cases across 193 countries. As the virus spreads through direct contact, it is essential to maintain social distancing. This leads to the need of telepractice in language therapy for aphasia. Telepractice is the application of telecommunications technology to delivery of speech language pathology professional services at a distance by linking clinician to the client or clinician to the clinician for assessment, intervention, and or consultation. The use of telepractice these days is important as it replaces the need of direct human contact in this time of need. Aphasia is mainly caused by stroke, brain tumor, traumatic brain injury, and progressive neurological conditions. In some rare cases, it can also be triggered by chronic neurological conditions like epilepsy and migraine. Aphasia is broadly divided into two main subtypes: fluent aphasia with poor comprehension and relatively preserved expression, and non-fluent aphasia, which refers to difficulty in production of language and relatively preserved comprehension skills. Fluent aphasia is further divided into wernicke's aphasia, transcortical sensory aphasia, conduction aphasia, anomic aphasia, and so on. And non-fluent aphasia is divided into global aphasia, transcortical motor aphasia, and Broca's aphasia. So we are going to describe treatment approaches for telepractice as described by American Speech and Hearing Association. So aphasia treatment basically involves two types of treatment: verbal therapies and multimodal treatment. The verbal therapies is only used for speech enhancement, speech production enhancement, and orthography, and only mainly includes picture stimuli. Whereas the multimodal treatment involves gestures, music, drawing, AAC, speech orthography, etc. So the multimodal treatment works on both verbal communication and total communication. Now we are going to describe some specific telepractice activities for aphasia. The first one is written communication. Okay, so written communication is written choice of communication is a useful strategy for many people with aphasia, particularly when their ability to read single words is relatively preserved. This could be helpful in cases with receptive aphasias. The second strategy is sharing photos. While using Zoom telepractice using the web platforms like Skype, Zoom, WebEx, and other platforms, you can use the feature of screen sharing and show the client photos of the target words. This could be similar to in-person therapy, but with telepractice, appropriate social distancing could be maintained. which is very important in the time of this crisis. You can make your own picture boards or select some pictures from it randomly. Text board can also be used for this purpose. The next technique is word finding and comprehension therapy for aphasia via teletherapy. So in this video, we are about an app named as the Naming Toolbox app. It is available on Android and Windows operating system. So when working on naming and comprehension in aphasia, many therapists use apps in face-to-face sessions. You can still use these apps via teletherapy by sharing your PC screen also. Another technique is the guess the word technique. So this technique is related to the Naming Toolbox app, and in this, when you go through different clues at the bottom of the guess the word activity, the other person will see and hear the written sentences. They don't need to touch anything. All they have to do is try to name the word in exactly the same way as they would in a face-to-face session. Press the reveal button so that they can find out if they guessed correctly. So this is a sample. Here could be a clothing item. So using this app, we can prevent it is present this to the case with aphasia, and here it would be the, here it's written like it is an item of clothing. Then it will be described it has two arms. Then it will be described it is red. Then the patient will guess what it is, and then we will press the reveal button, and it will be described it as a red t-shirt or blue jeans, etc. Describe the word. The describe activity in the naming toolbox has an inbuilt semantic feature analysis cues. Read the cues aloud for the client. What do you do with it? Where do you find it, etc. So by using this, we can uh, having a picture of a mango here. So what do you do with it? We eat it. How is it? It is sweet. And then the client will describe all of these things, all of the things he knows about the object, such as uh, here we have a mango. So what is it? It's a mango. It's what do you do with it? We eat with it. We eat with. So how is it? It is sweet. So in this way we can describe it. Spoken or written word to picture matching. So when you this also can be used through the app, or you can make it by your own also. And in this the person with aphasia would touch the tablet screen for in face-to-face session, and for this there would be written, for example, here is written a teapot. So the client will have three choices, and he will have to select the correct choice and uh, press the mouse button on it or drag it towards this pad, and then the software, or if you are not using any software, you can tell it to the client that he did perform it correctly or not, and then it will be the next one, and we will press the next button, and so the items will be described. This app consists of at least 50 items. News and other stories. So if you need to work on higher level comprehension, you could screen share activities from websites such as News in Levels, Talk, Path News, or British Council News. This is specifically designed for people with having communication difficulties, and by going through these websites, you can work on higher level comprehension of the case with aphasia. Pixar short story narrative therapy. So when doing narrative therapy with clients with aphasia, we mostly want silent pictures such as Pixar short stories. If you share your desktop screen in your web platform, you can access YouTube and play videos that your client can see. Another great option for narrative therapy is using personal photos of life events. So we can show the client Pixar short stories, and we can also use it for personal photos of life events, such as we can make life events photos for the clients life events also. So we can use that too. And this is the Pixar short films collection volume 2, and the Pixar web stories are available at many web platforms, and these can be used in cases to develop comprehension skills and expression skills and so on. Copy and recall treatment. So if you have an app with flashcards and written word with a writing therapy app, you can display it by your iPad screen or your uh, computer screen or your desktop screen or your laptop screen, wherever you want. And you can use this by dragging the mouse pad from one place to another. And here is a sample we have. Tap it out and repeat. So the client will tap out a photo and then the photo. For example, this photo having a beach here. Beach, tap, repeat. And here a woman in front of the tree. Woman, tree, tap, repeat. So this is how tap and copy and recall treatment can have. This could be very helpful in cases with using the cases with using recalling memory, and who the cases who forget easily can be benefited from this therapy technique also. Functional writing, text messages and emails. So this is the low end device, a low end method you can use. So you could read some sentences aloud and ask the person with aphasia to type them in chat. They may have a set list of functional phrases that could work on for use in text messages or emails. If you have a file with those phrases, you can open it on your desktop screen and share your screen and so on. So by this you can uh, communicate with the client without using any software. So this is the last resort. We would suggest that you use it at the last when you are having some internet problems or the network facilities is not particularly well in our country. In rural areas the internet service is not as fast as the urban centers. So if we have to give therapy to a client living in rural areas, we could definitely use this and this would be very helpful for him. So these are all the techniques we can use for teletherapy for aphasia. Use of telepractice in aphasia is necessary these days for the protection of both client and the clinician during this time of rapid infection spread. And as the client with aphasia also has many physical comorbidities, the client with aphasia would be at risk of developing the infection, and this could be lethal to his life. So not only this can help the clinician and the client, but this could uh, also help the prevention of the disease further. So we should follow the guidelines also. So at the last, I would like your attention to be diverted to a very important topic: preventive measures for flu and COVID. So even if you are practicing from home and you daily go out, and if you have to work outside, then you have to be cautious, and you have to take all the precautions in order to prevent any infection spread. So as the COVID-19 is spreading at a very rapid rate, we have to follow many things. Uh, so please follow the directions of the World Health Organization or government organizations for well-being of you and for others. The first one would be washing your hands, which is best. For soap for at least 20 seconds. Use hand sanitizers, alcohol based, when washing is not an option. Avoid close contact with people who are sick. Stay home whenever unnecessary. Uh, face face mask should be used, and wearing a mask is recommended for everyone. And uh, wearing it in public places is most important, as public places are at a risk of infection these days. Cover your cough or sneeze. Use a tissue, trash the tissue, wash your hands into your elbow when the tissue is not available, and clean and disinfect very often with the household cleaning wipe product, and regularly use surfaces like mobile phone, TV remotes, and door knobs, door handles. You have to disinfect them regular intervals, because this would be very helpful in containing the virus. So at last I would want to say that thank you for listening, and please take care of you, your family, and most importantly your client also. Thank you for listening. Bye bye.